The World Health Organization estimates that of the 270,000 women who die from cervical cancer every year, majority are from lower and middle income countries. The WHO also says that in Ghana, an estimated 3,000 women are diagnosed with cervical cancer each year, and half of them die.
Unfortunately, a lot because it's asymptomatic, or usually people who have it will not develop any symptoms. By the time a lot of our women are picked up, it's really an advanced stage, and unfortunately, there's not much that can be done. But there's what is called palliative care. Palliative care involves things like pain management and so on, trying to make the person comfortable as much as possible despite having the advanced stage of cancer. Psychosocial support, that is when the person is supported and encouraged, and sometimes things like support groups and such help them through this difficult stage of cervical cancer. Cervical cancer is preventable. That's the great thing about this disease. It is preventable, and it's really important that the health system should ensure availability and access to all the levels of prevention that I've talked about. Like we said, it's now available in the developed countries, so it's about time that these services became available in the developing world.
The Women and Girls Forum, organized by the Ghana International Women's Club, is trying to create awareness about the dangers of cervical cancer.
We also get to find out that it's not just a woman's issue. Cervical cancer is also a man's issue because it is actually one of those cancer that's actually caused by infection through sexual intercourse. So it involves men and women, and it also involves younger ladies, which is the reason why we thought we will bring the schools to get involved. In developed world, the vaccine that prevents cervical cancer is actually administered to boys and girls from age 9 years old. So we felt that it would be good to get all of these groups together and let's have a discussion. Let's put it out in the open out there and let people realize that it's something that they can do. They can take action themselves and help and spread the word. Our hope is to actually provide the C-arm imaging machine for the oncology department at Kolibri, which is the main head oncology department in the country. So hopefully with that, we will be able to address some of the challenges, making sure that we can diagnose early. We can also the doctors can also get the support during surgery to make sure they can remove the tumors if it's necessary, and also to allow for pain management as well with radiotherapy as well. So it's one step at a time. If we're able to buy one, because one machine is 150,000 euros, so it's a lot of money. So it's going to require a lot of going around, knocking on doors. Corporates, we're coming, to knock on your doors to actually help support and save the lives of our women and girls.
Currently, there are only 3 centers in the Greater Accra and the Ashanti regions for curing the disease. But Dr. Jowoyani, an oncologist at Kolebu Teaching Hospital, says it will take more than 3 centers to fight the deadly disease.
For instance, there are only 3 radiotherapy machines in Ghana, 2 in Accra, 1 in Kumasi. So if someone is in Upper East region, the geographical access is a problem. Radiotherapy treatment spans about 5 weeks, sometimes even 7 weeks. Where are you going to stay in Accra for 7 weeks? Are you going to stay with relatives? You see, so that is a problem. So we would have loved that they will be dotted, at least 1 in each region would have been the best. Okay, setting up a radiotherapy center is not easy. Yes, indeed, in West Africa, it's only Ghana, Nigeria, and Senegal. Yeah, Nigeria has 7 centers. A lot of times, most of them are not working. So we even have patients coming all the way from Nigeria too. So it's capital intensive, right? But compared to other modalities, maybe cost effective. But the initial capital is not a joke. The additional capital outlay is not a joke. So it's expensive. Again, priority, we have to prioritize management of non-communicable disease, and therefore allocate money for it. And even running the radiotherapy center is not child's play. So these are the causes of the paucity of number of centers that we have.
Dr. Yani urged women to report any sign of persistent genital infections since early detection, screening, as well as vaccination are crucial to the fight against cervical cancer.